Hi, so today I'm going to be talking about mental health units and the lack of accommodations for those with disabilities during treatment when they're on the unit. So I noticed this across all three of my hospitalizations, but it just became very apparent to me during this most recent hospitalization, kind of like the lack of comfort items. Um, so, and these two go hand in hand. You have to be able to deal with those with that have disabilities on the mental health unit and give them accommodations like they would get in schools. And that doesn't happen right now, at least not in Maryland. Um, this frustrates me, not because I have disabilities, but for this upcoming generation that is in mental health units as kids and teenagers, what will it be like for them if it continues to be this way for adult units? What is it like for them right now in the units that they get admitted to? Um, so that is just so frustrating as a person with disabilities, as an advocate for people with disabilities like I am. I literally did not understand why I was not allowed to have a comfort item as a person with a disability on a mental health unit. I was literally told, if we allow you to have one, then we will have to allow everyone to have one. That's not true. There is this thing in the United States called the Americans with Disabilities Act. And if a mental health unit doesn't abide by that, how can we expect other places to abide by it? Because mental health unit is in a hospital, and they have nurses, they have medical providers that come to the unit. They have like a medical doctor that comes to the unit. They have specialists who come to the unit if need be, um, and do sometimes. But that's not an accommodation. That's just a need. Um, um, so there's a difference between a need and an accommodation. An accommodation is something specifically for that person with disability or multiple disabilities to help them get and participate better in the treatment than as those that don't have disabilities. Yes, my teddy bear was locked up in a locker across from my room in the nurse's station. That's not the same thing. as actually having it in my room with me, like I do here. It literally brings me comfort. And I've had this specific teddy bear since I was 4 years old after the tree accident. How do you expect society at large, like schools, to abide by Americans with Disabilities Act if a hospital doesn't abide by that in a mental health unit? I'm just asking, and I think it's a fair question, and it's fair criticism. I mean, I could be wrong, but how are people with disabilities supposed to do the treatment, go based on the treatment plan without knowledge of what's going on if they can't physically sit still or can't, or they get overwhelmed easily, or whatever the case may be? I'm just bringing this to light, and it, like I said, it frustrates me as a person with disabilities, along with as a person that is an advocate for those with disabilities. So that is it for tonight, and I would talk again tomorrow. Thanks. Bye.